Assalamualaikum. Hi, Lai. Good afternoon.
Walaikum assalam. Hi,
How are you today?
I'm doing fine. Thank you.
Okay, my pleasure. So, Lai, is that okay if I record this conversation? This is for my SETP project.
Absolutely no problem. Yes,
Okay, thanks, Lai. So, the first thing that I want to ask is, where do you come from?
I come from Yemen.
Where exactly is Yemen located? Is it in Asia?
Yeah, that's right. It's located in Asia, specifically in the southwestern to southern end of Arabian Peninsula.
Oh, I see. So, you are now in Indonesia to study?
Yes, that's correct.
And what major do you take?
I actually now study engineering informatics or informatics engineering.
Oh, interesting. Which semester?
Currently, I have finished the fourth semester and I will begin the fifth semester soon.
Oh, that's great. I hope that you like studying in Indonesia.
Yes, of course, Nora. Thanks.
Anyway, Lai, do you remember about COVID-19 pandemic that happened 4 years ago?
Yes, of course. I do remember it. The situation was so challenging and it was so hard to adjust to the changes at the time.
Yes, that's right. The numbers keeps rising and affecting so many aspects of our daily lives.
Yeah, the main effect is so many people die and every traumatized by the situation.
Yes, that's true. In my country, the first thing that government did was implementing a lockdown. So everyone did their activities from home, starting from those who work, those who went to school, and everyone who did activities outside.
So, what about the health workers? Do they still work to serve the community?
Of course, health workers are really needed to take care and treat COVID patients in hospitals. They become vulnerable physically and mentally exhausted because of the ongoing crisis long in giving health services.
Okay. If the health workers are still going outside during the pandemic, aren't they at risk of being exposed to the virus, the COVID-19 virus?
Yes, because it is their duty and obligation. Even though many health workers have died while working due to coronavirus.
All right. So, what about the other government policies?
Apart from the lockdown, people are required to follow the 3M guidelines, wearing masks, washing hands, and maintaining distance.
Are vaccines not given in Indonesia?
In Indonesia itself, the vaccination program has been carried out since January 2021, so it is necessary to give booster vaccinations to maintain the immunogenicity of the vaccine against COVID-19 infection. Then, in accordance with WHO recommendations, the administration of booster vaccine or follow-up dose will be signed by the government with priority given to population at high risk of affected, namely the elderly, health workers, and groups of individuals who have immune system problems.
I see. That's really good information.
Oh, and what about the government policy against that situation in Yemen?
Well, according to my country, Yemen has faced significant challenges due to COVID-19, exacerbated by ongoing conflict and humanitarian crisis. So the government policies regarding COVID-19 in Yemen have likely focused on containment measures, healthcare support, and managing limited resources aimed at the conflict.
And what is the biggest impact of that government policy?
Well, for the biggest impact of government policies related to COVID-19 in Yemen, include severe strain of the healthcare system due to limited resources and infrastructure, and exacerbation of humanitarian crises such as food insecurity and displacement, economic downturns, from measures like lockdowns and difficulties in implementing public health measures like testing and vaccination campaigns due to logical and security challenges.
Oh, I see. Well, I think not much different from the impact that occurred in Indonesia. And what about the vaccines in Yemen?
Okay, for the vaccines, so Yemen has faced challenges, as I told you, in ascending the distribution vaccines against to COVID-19 factors such as the ongoing conflict, the logistical difficulties, and limited healthcare infrastructures. So it has have hindered the vaccination efforts in the country. International organizations like UNICEF and World Health Organization have been involved in supporting vaccine distribution, but the process has been slow and uneven across different regions of Yemen. So efforts to impact or improve in vaccination coverage continue amidst these challenges aim to mitigate separate COVID-19 and its impact on the public health in Yemen.
Oh, sorry to hear that. Were the pandemic regulations in Yemen strict?
Well, during the COVID-19 pandemic, Yemen faced challenges in implementing strict regulations uniformly across the country, so it wasn't that strict.
Oh, that's positive. Hopefully, many people will adhere to the regulations.
Yes, that's right.
In my opinion, with this government policy, people will be more aware to their health during the pandemic situation.
Yeah, and if they comply with the rules, the numbers of people exposed to COVID-19 will also continue to decrease.
Yes, you're right. So, Loai, I think that's enough for our conversation. We have discussed a lot about government policies towards COVID-19.
Yeah, it's nice talking to you, Nara.
Thanks for your time and for your help.
That's my pleasure.
All right, good night. Good afternoon.
Yeah, bye-bye.
Okay. Um, so it's done. Thank you so much for your help.
Of course, no problem. Yeah,
Okay.
you did
Um,
well. Good.
okay, thank you. Okay,
All right.
bye. Assalamualaikum.
Alaikum salam. Bye-bye.